Those stable contractual frameworks need to be of a sufficient duration to get the best value of money for patients and taxpayers. And what we mean by that is essentially, if you get a longer contract, you need to invest as a home care provider in reducing NHS transaction costs, and then the NHS needs to work with you much more closely in managing patient cohorts of who are enrolled in home care and looking at issues around constantly how we can improve VFM within home care. This is also the third recommendation, which is we need to get better software systems, and JAC and others I know are looking at this at the moment, and ascribe to invest in more e-technology, which cuts out, frankly, the paper and the people, and also gives us a safer, more reliable system, both inside trust and across home care providers, so that we can understand service levels and get the best costs. At the same time, we are clearly recommending that for the direct supply from pharma, where they essentially tell the NHS this is your home care and this is the cost of your drug, that we recommended to Keith Rich that that should stop, and that should be separated and open and transparent, so we understand. I've learned a lot about the prescription pricing scheme and all this sort of stuff, and it doesn't head in, but essentially within that there are costs that are embedded for distribution, as I understand it. There are costs for certain levels of profit, and there are costs associated with the supply of the drug and the home care, and we just need to see them all and understand what those savings are in the context of switching to home care supply, and particularly within the procurement. The other thing that we, unsurprisingly, we're recommending is that there should be a series of national standards which cover major areas around governance, operational control, and these sort of approaches. So what do we mean by that? It means, how do you select patient cohorts, how do you communicate with them, what the system of care is between hospital and home care, and who's responsible for what, and what are the quality management systems between the two providers.